typically patients come to us, they've had a spot on their skin that they're concerned about. They may think it was originally an ingrown hair or just a rough spot that won't heal. Then we typically take a look at it, and then if we determine that it's suspicious, we put a little bit of numbing in the area and we just take a little slice of that. They're numb, and then we put a little piece of the tissue in the bottle and put a Band-Aid on, and they go home. And we call them back in about a week's time. And depending on the results, if they have a skin cancer like a basal cell carcinoma or a squamous cell carcinoma, we'll have a consultation with them, bring them back into the office, and talk to them about the different options. At that point, if they decide that they want to do the SRT, we go ahead and schedule what they call a simulation. And in the simulation, that is kind of it's a day. We don't use any X-ray treatment during that session, but we do set the patient up. We get them in a comfortable position, and then we put lead shielding in all the appropriate areas to make sure that they're protected. And we actually, draw a circle around the area that we biopsied that clinically looks like a skin cancer. And we draw another circle around that as a margin. And then at that point, we come up with a plan. And we tell them, how many times a week do you want to come in? And they give us their schedule. And at that point, we schedule them, sometimes 3 times a week, sometimes 4 times a week. We even have patients that come every day during the week. And those are quick appointments. Typically, they're 15-minute appointments, unless they have multiple skin cancers. At that point, we've got our prescription. We have our number of treatments that we want to do, our total dose. It's all calculated for them. And then they come in, and the appointment is fairly straightforward. The radiation therapist brings them back into the room, lay them down, or have them sitting, whatever the chosen position is. Place the shields on any radiosensitive areas and put the applicator over the lead shield over the tumor, and then the treatment begins, and the RTT just steps out of the room. The patient is still, we can see them with a video camera, so we can see what's happening to them in the room, and they're usually just fine in there. And then we start the treatment. The patient hears a beeping sound. And during the therapy, after about the 5th or 6th treatment, it's normal for them to get some redness in the area that we're treating. That redness is a sign that the X-ray is working. It's getting a good biological effect, damaging those cancer cells. If it's not red after that treatment, we adjust. We make sure that the dose is what it needs to be. And then that red spot will typically stay there for the remainder of their treatments. And then when they come to their last treatment, we just have them do nothing at all, really, at that point. They can put some Aquaphor healing ointment on the area if they want to, but it will heal up on its own regardless. And then in 2 weeks' time, the redness is gone, the cancer's gone. We've already monitored it through the process with the ultrasound treatment to show them that the tumor has shrunk and it's gone down. And that final appointment is just for final confirmation. And that's it. After that, we follow them up every 6 months to see, if there are any new skin cancers emerging on their skin. And if they have a couple of appointments after that where their skin has done well and we haven't found anything more suspicious, we push it out to once a year, just follow up. And even though we set these arbitrary numbers for follow-up, if they have any suspicious growth, obviously in between, they don't wait for 6 months to come see us. They give us a call right away and come back in, get it treated early.